Postpartum depression, or PPD, affects millions of families every year. And yet, there are so many misconceptions and stigmas that surrounds postpartum depression, or PPD. So, today, let's break down the 5 common myths about postpartum depressive disorders. The first myth is it's just the baby blues. Many believe that postpartum depression is just the baby blues, but that's actually not true. The baby blues are short term mood changes caused by hormonal shifts, typically lasting 1 to 2 weeks. Postpartum depression, however, is more severe and can persist for months or longer. If you're feeling overwhelmed, sad, or disconnected for an extended period of time, it's important to seek for help. Myth number 2: postpartum depression will fade away on its own. Postpartum depression doesn't always resolve by itself. While some parents may feel better over time, many require professional support, therapy, or medication. Ignoring these symptoms can make recovery harder, and reaching out for help isn't a weakness. It's a brave first step towards healing. Myth number 3: only the birthing parent can experience postpartum depression. Postpartum depression doesn't just affect birthing parents. Partners and non birthing parents can also experience postpartum depression. Adjusting to parenthood, sleep deprivation, and emotional changes can impact anyone in the caregiving role. Remember that mental health challenges doesn't discriminate. Fourth myth: lack of sleep is just part of being a parent. Parents commonly experience sleep deprivation. Newborns can disrupt sleep as they require feeding and care needs. This is particularly true for new parents as they are adjusting to parenthood. Sleep is essential and should be prioritized. Learning what works best for you and your children is the key. Fifth myth: I'm a bad parent. Postpartum depression is my fault. People with postpartum depression experience emotional highs and lows, fatigue, and have trouble caring for their own. Regardless, having postpartum depression doesn't make you a bad parent. There's nothing wrong with asking for support, and it's not your fault nor anyone's fault, and it is not a weakness. So remember to ask for help. Support is the key, and it is not a weakness.